Hello, what's up friends? In this video, I will be sharing with you some very important and hot one-liners in anesthesia. So stay focused. So number one is, it was asked in an exam that the World Anesthesia Day or the World Ether Day, both are same. It's 16th of October. Then father of anesthesia is John Snow. You can remember it like the father of anesthesia lives in a snowy place, so his name is John Snow. The father of anesthesia lives in a snowy place, John Snow. But the modern father is W.T.G. Morton. So the father of anesthesia is John Snow, but the modern father is W.T.G. Morton. Then the choice of anesthesia for porphyria is propofol. Then there are different Mapleson circuits, so you should know basically. It is to be studied in detail, but the question asked is Mapleson A is for spontaneous ventilation, while this Mapleson D circuit is for controlled ventilation. Then the other point is ketamine acts on NMDA receptors. TIVA. In TIVA we give propofol and remifentanil. Then there are two types of means neuroleptic analgesia and anesthesia. In analgesia, we give droperidol and fentanyl, while in anesthesia, nitrous oxide gets added. So combinedly, it forms a neuroleptic anesthesia. In analgesia, we have droperidol and fentanyl, and when it comes to anesthesia, nitrous oxide will get added. Then isoflurane, or you can say if the question asks a drug of choice for cardiac surgery with good left ventricular function, it will be isoflurane, and if with poor left ventricular function, then it will be opioids. Then another question is who performed the first endotracheal intubation? The person was mcEwan, and who performed the first endotracheal intubation? He was Evan McGill. How you can remember this is, it's very confusing, the first endotracheal and first orotracheal. So you can remember that the endotracheal was done first and then orotracheal was performed. So you can see mcEwan here, mcEwan. Then you can proceed the name with Evan McGill. So mcEwan is first and then Evan McGill. So first endotracheal intubation was done, then orotracheal intubation done, then mcEwan, then Evan McGill. Okay, so best for pediatric surgery anesthesia is sevoflurane. Then ketamine. Ketamine as an anesthetic agent is agent of choice for congenital heart disease with right to left shunt and CHF. Then you have to know some points about Mendelssohn syndrome. It is basically chemical pneumonitis caused due to aspiration of the content whose pH content is less than 2.5, and the minimum volume to cause Mendelssohn syndrome or chemical pneumonitis is 25 ml. Then anesthesia, inhalational anesthetic contraindicated in renal disease and epilepsy, means you have a patient with renal disease and he is having epilepsy, so you cannot give him enflurane. The question is asked, okay, deranged renal function with epilepsy or CNS disorder, so you cannot give enflurane, it is contraindicated. And likewise, propofol is not given in obese patients. Then halothane does not undergo spontaneous oxidation as it contains thymol. So the thymol prevents its spontaneous oxidation. Then there are two things, Entonox and Heliox. You can see from the name Entonox and Heliox, they both contain oxygen. Then Entonox have nitrous oxide, while Heliox have helium. But the content, the percentage of the composition is different. Entonox contain both 50-50%, while Heliox contains 79% of helium and 21% of O2. Although these percentage are not that much important, but you should know that what the content of both the gases. Then there are different pin index used in anesthesia for fixing the cylinders. So for CO2 there are two pin index, 1,6 and 2,6. Basically differ in their concentration. If CO2 concentration is greater than 7.5, it will be 1,6, and if less than 7.5, it will be 26. And the color coding for different cylinder is oxygen. You can see the oxygen cylinder, you must have seen it during the internship, that the oxygen cylinder is black with white shoulder. Nitrous oxide cylinder is blue, means total the blue cylinder with blue shoulder. And the combination, if you see N2NOx, so it will be combination of nitrous oxide and oxygen. So you will have a blue cylinder with blue and white shoulder. Halogen cylinder is amber color. Then drug of choice or the drug given in post-op shivering is pethidine, and it is also an antidote for halogen shakes. So pethidine is given for post-op shivering. Question asked for post-op shivering, what to do? We can give pethidine, and it is also antidote for halogen shakes. Then we have seen maplesin A and D. Now here is maplesin E. It is also called A or T modification. And the maplesin F circuits are used for children less than 6 years or weighing less than 20 kg. Now in case of anesthesia with succinyl choline, the last muscle to paralyze is diaphragm, and the diaphragm is also the first muscle to recover. So you can know the muscle as diaphragm. If any question is asked, it will be which is the last muscle to paralyze or which is the first muscle to recover. In both the cases, the answer will be diaphragm. Then two anesthetic agent which causes pain on injection are hapentone and propofol. Although there are many, but these two are main. Then highest, it is a controversial question, but till now you have to remember that the highest fluoride content is CO and the lowest fluoride content in methoxyfluoride. Then in anesthesia we get a hypoxia type of condition. So, and also for CPR the total time is 22 seconds and GCS score less than 8 requires intubation. These are just one-liner which may be asked and important for you all to. Then this one is very important, that type E cylinder is most commonly used in anesthetic machines and it has O2 of 660 ml, sorry 660 liter, and next above type of cylinder which is used is F type, which has 850 liters of O2, and immediately below is type D, which has 470. So you have to remember the value as 660, 850 and 470. Another question which is asked with the figure was Tohi needle. Tohi needle is used for epidural anesthesia. Then the important question is, all the cranial nerves can get affected in spinal anesthesia except 1, 9 and 10. Which is the most commonly involved cranial nerve in spinal anesthesia? It will be 6th. Now some of the important question asked that how many days before the surgery we have to stop certain drugs, like aspirin is stopped 7 days before the OT, warfarin is 4 days, heparin is 6 hours before the, means at max 6 hours before the OT. 6 hours, that will be unfraction type. Okay, so I will be making another video to cover the rest of the important topics in anesthesia. Till then, stay focused and study hard. Thanks.